So Vinay, we've got a great question for you. You have been diagnosed with intractable pain secondary to the unfortunate consequences of chemotherapy that have left you with neuropathic pain throughout your body. How best do you feel an intrathecal pump delivery system, as Hemant described earlier, would be beneficial, or do you think going with oral medications might suffice?
So for neuropathic pain, we have a long history of being able to treat this with medications initially. So when it comes to options, these are things you want to lay out early, like what the options are from a neuropathic pain medication standpoint. It's medications there are some evidence-based treatments like duloxetine for the chemotherapy-induced neuropathy. But at the same time, as when you meet a patient early on, you want to go through all the options that they might have, so that they can get those options early, because they may be of limited lifespan. So they might want to hear about these things early so they can make those decisions. So we can talk about neuropathic pain medications. We can talk about opioids for refractory neuropathic pain. But many times nowadays, patients don't want to hear about opioids as much. They're reading about things in the newspaper. It's not something they want to discuss. So that's when we get to interventional treatments like intrathecal drug delivery early as an option. It's a way to minimize your exposure to opioids and decrease your side effect profile. So it's something that I would offer and get to very early when I see a patient in the clinic.